All right. Welcome everybody. My name is Catrielle, and on behalf of the CHPCA, I just want to welcome everyone and thank you all for joining us today on this, what is sure to be a very fascinating and thought-provoking call, all about the Nav-CARE program and all of the hubs and the work that they're doing across the country. I just want to start off by acknowledging that I am joining from the traditional Algonquin and Anishinaabe territory here in the National Capital Region. And I will now hand everything over to our intrepid guide throughout this presentation, Gloria. And I hope everyone has a wonderful webinar and is as eager to learn more as I am. So take it away, Gloria.
Thank you so much, Kat, and thank you very much to the CHPCA for hosting these webinars. It's been such a pleasure to work with them. They are indeed a lovely, amazing bunch of people. So welcome everyone. My name is Gloria Praveen. I am the project lead for the Nav-CARE program that's rolling out across Canada over the next couple of years. And I am located on the traditional territories of the Squamish, Tsleil-Waututh, and Musqueam people. It is a beautiful but rainy day here, and I, as per usual, for January in the southwest coast of Canada, and I just welcome you to give a thought about where you're located and the lands that you are on, and acknowledge the traditional territories from which you're located. So I'm just going to share my screen for now, and there we go. And today we're going to be talking about implementing Nav-CARE, and I am just so excited about this webinar and the folks who are on this call with me. We've got people from across Canada, and that just makes me so happy. So I'm just going to quickly take a moment to introduce them, but they're going to be joining and the conversation a little bit later on in the presentation. I'm going to blather on for about 10 minutes, and then they'll come in and talk about their experiences. So we have BC Akintola from Hospice Halifax, Carolyn Parks from Hospice Peterborough. Maybe you both could give a little bit of a wave. Cynthia Lapointe, who's from Teresa Delar Palliative Care Residence in Kirkland, Montreal. She's not quite here yet, so hopefully she'll be joining us. Then there's Emily Ballinger from Home Hospice North Lanark in Ontario. Linda Merlo from Greater Trail Hospice Society in the South Interior of BC, and Sandy Pringle from Terrace Hospice Society in Northern BC. So a real range across the country. And it's just such a neat thing for me to witness and come to understand these different provinces, these different jurisdictions, and these different ways that Nav-CARE gets implemented within these contexts. So I'm going to talk a little bit first about what Nav-CARE is, and then just give you a real brief overview about the funding call to develop Nav-CARE Hubs. And then we're going to really turn it over to the panel to talk about these key considerations to implementing Nav-CARE. So by the end of it, I hope you get a better understanding of the program, that you've learned some things about how to implement it and how that could be applied in your own context, and get an idea of what that funding call is about. And but let's just go back here. And then I just want to let you know, I forgot to do this at the very beginning, sorry, Kat, that we will be taking questions throughout the presentation. And so we'll have some key points throughout that I will look into the question and answer box. And then we can either float the questions to the panelists or to myself. And so that's throughout the presentation, but we should have ample amount of time at the end to also address some of these questions. So if we don't get to them during the presentation, then definitely after. So I'd like to give a real shout out to our funders over these years. Nav-CARE has been really generously funded through all these different organizations, and this current one, we are being funded through, given a financial contribution through Health Canada to roll out Nav-CARE across the country. And then, of course, Nav-CARE could not be possible without the Nav-CARE volunteer navigators, who, as one client has said, they make life more livable for us who are living at home with declining health. And the program itself has been developed by Barb Pessett and Wendy Duggleby, and all these amazing research participants from organizations across the country to develop Nav-CARE, develop the competencies, and develop the program that you are seeing today. So I would like to begin with a bit of a story, and this is the story about John. And John is a 75-year-old man who's living at home with his wife Anna of 55 years. And over the past 5 years, he has been the primary caregiver for Anna, and who has dementia. And he's also really struggling with his own concerns. He's got some declining health, and he's becoming increasingly frail. And John has a fall and he must be hospitalized, and Anna is hospitalized with him, as there are no sort of supports in his community to enable Anna to still continue to live at home whilst he's in the hospital. However, sadly, Anna dies while in the hospital, and John comes home alone, feeling without purpose. He feels guilt-ridden, wondering if he could have done more for Anna. He's having real struggles taking care of himself because of his lessened mobility, and he's grieving. He is really sad. So John is at this fork in the road. He's either going to continue on a path that is of regained independence under these new circumstances, or he's going to have this experience of a downward trajectory with increasing frailty. And here's where a skillful volunteer could really make a difference in this fork in the road. Imagine a skilled volunteer establishing a relationship with him, providing him social support, helping him find new connections in his community, or helping him reignite some of those old connections, and really giving him a chance to feel engaged again with a purpose in life. This is the story of many of our clients who are experiencing declining health, and the story of the Nav-CARE project. Whoop, sorry. So Nav-CARE provides specially trained, mentored, and experienced volunteers to work with persons and their families living with declining health to improve their quality of life. And the goals of which are kind of fourfold. The first is to really provide early support. So it's adopting a palliative approach to care. So folks are not necessarily experiencing a palliative diagnosis, but they are living with some sort of need related to some declining health. And so a volunteer goes in early. The second goal is to build volunteer capacity, and Canada has this really amazing, strong traditions of volunteering, and it's really to build upon that. And you think about hospice palliative care organizations and their incredible way of promoting the work of volunteers and fostering volunteerism within our communities. So it's building upon that capacity for volunteers. The third goal is to optimize and access to resources. In the previous research, we've understood that very few individuals know about the organic resources in their communities, and so those resources go underutilized. And Nav-CARE volunteers are trained to help connect people to these relevant resources within their communities. Then that fourth goal is about building social connection. So there's a worldwide movement towards building social capital within our communities and fostering compassionate communities, communities who care for each other. So how do they do that? How do we reach this? So volunteers are educated in competency-based navigation skills, and they're learning how to address quality of life concerns. They're advocating for clients and their families. They're facilitating those community connections, and they promote active engagement and support virtual navigation. Volunteers are able to take online training, and the organizations support those volunteers and mentor those volunteers to gain these types of competencies. And so These are there to help volunteers support a person who might be feeling lonely or socially isolated. The person might be facing loss and declining health. Somebody like John, who we talked about earlier, they might be facing some complex treatments and complex decision-making that needs to come around with those treatments. The person may be living at home or in long-term care or in assisted living. They could be living in an urban, rural, or remote location. So as you can see, that Nav-CARE volunteers can really help and support a real diverse group of people. And so they're really helping these people with daily challenges such as those listed here. And these challenges are concerns that really directly impact health and healthcare, but don't really fall within the purview of healthcare providers themselves. So for example, John being the caregiver for his wife, he may not have had a lot of experience in preparing meals and grocery shopping. Anna was doing all of that prior. And so a volunteer could really help him in meal planning for the week and connecting him to services that might, if there are those services in community, to deliver those, deliver groceries to him. So these are some of the things that they can help with. And so what do these volunteers actually do? And the biggest one, I think, is about developing relationships with people. They have that luxury of time where healthcare providers don't have that luxury of time, and they have the luxury of time over a long period of time. They are able to provide care for that person over, months and years. And so they really develop that relationship. They, of course, can assist with tasks and that people start to find really difficult to navigate. They connect them to resources. And a big part is also listening. They listen as that person makes these decisions and makes these transitions that arise out of declining health. And then finally, providing a safety net for those living at home alone and or without family nearby. So as we think, that was just a very brief overview of the program, and you will learn so much more about the realities of the program from our panelists in a few minutes. And so, but to transition to that, I just want to talk about this funding opportunity, and you can learn more about that on our website. This is the last year that we'll be providing 2-year funding to develop Nav-CARE and hospice palliative care organizations across Canada. And we do this by a hub and spoke model. So funds are given to one organization to implement Nav-CARE, and then that organization supports implementation into smaller hospice palliative care sites or other organizations. So for example, Linda, I'm looking at you because I could see you on my screen. So Linda and Trail Hospice, the money goes to Trail Hospice, and she supports 2 other communities in Castlegar and in Vermeer that are not necessarily that close, but she's supporting them to develop Nav-CARE in their organizations. So by supporting their volunteer coordinator there in terms of the education of the volunteers, answering questions, helping them find resources, and so forth. So there is that expectation that Linda would support those two smaller hospice sites. So to receive this, the hubs are committed to hiring a dedicated part-time Nav-CARE volunteer coordinator. They train 30 volunteers between the hub and the 2 satellites. They serve 60 clients. They co-facilitate educational webinars such as this. And there are some reporting requirements that are on specific indicators. And in return, there's $60,000 that's from the contribution from Health Canada over a 2-year period to support this part-time volunteer coordinator. You receive access to all the Nav-CARE stuff. You are invited to participate in a monthly hub huddle, which is, I think, always so much fun. And then I provide you with some training reports over these 2-year period, and then we profile your hub in knowledge products, and that's been been going through CHPCA. So I don't know if you've read any of the eHospice's articles on some of the hubs, but you can find some of their sort of examples there. And so the key selection criteria is basically what we're going to really be talking about today. So is Nav-CARE a good fit? Do you have capacities to start, to sustain it? Do you have a sustainability plan? What kinds of partnerships do you have to support that hub and spoke model? Do you have a volunteer pool that you can draw from? Do you have a client set in the community that you can work with? And can you find a volunteer coordinator to champion the program? Now I look to the panelists, and here are champions and of the program. They are real dedicated, incredible women who are championing the program, and without them, this doesn't quite work. So you're going to be hearing from them in just dangling that carrot. You're going to hear from them in a couple of minutes. So you can find out more about this funding call on our website. You are most welcome to connect with me via email, nav.care@ubc.ca, and I can answer your questions. I'm willing to jump on a Zoom call with you, or do even a presentation to your organization if you would like. But the application date is March 1st, 2023, and you'll be notified quite quickly within that month. So we aim for March 31st for a notification date, and then we expect that implementation would be in early June. And the reason for that lag is sometimes it takes a little bit for us to get the paperwork completed with UBC. So we're gonna now sort of transition and thinking about what you need to think about when considering implementing Nav-CARE. And these kinds of questions are outlined in our implementation manual. And we ask you to carefully consider these kinds of questions if you're like, hey, this sounds like a really cool thing to do. So, and so we've sort of designed the rest of this presentation to go back and forth between sort of what kind of stuff is in that implementation manual and then what the perspective is from these panelists. So the first question that we would ask you to consider is whether it fits with your organizational strategic plan. So Nav-CARE was really designed to fit with important directions in hospice palliative care identified by palliative care leaders in Canada. And these include implementing a palliative approach, supporting a compassionate community approach, optimizing the work of volunteers, educating the public about palliative care, reaching a variety of people with palliative care needs, including those who might be experiencing loneliness and isolation. And so I'm going to turn it over. I'm going to actually stop sharing my screen, and I'm going to turn it over to the panelists who are going to talk to this question, how Nav-CARE has aligned with the strategic directions in their organizations. So I am, oh, hi, Cynthia, you made it. Awesome. So I'm going to ask this first question of, we'll start with Linda, if you could speak to this question, and then I'll call up each of the panelists as I see you on my screen. Oh, we're not hearing you. Oh dear. No, that's so strange, Linda, as we had a conversation just before the webinar started. So how about I will go to somebody else on the panel and see if you can figure out what's happening with your microphone. So Cynthia, how about from your perspective?
Yes, absolutely. Hi, everyone. It's a very important question. I think that Nav-CARE is in my experience over the last 8 months, is a fantastic program. I've seen such help being given and provided to our clients. But you do really have to make sure that it aligns with your strategic vision of your organization. And I think it's important in the sense, looking at your organization in terms of what are the things you're doing for compassionate community development in your area. I think it really, you want to make sure that you have clients in your area that are in need, and that you're able to reach them, which is a challenge. It does take, it takes a lot of planning and coordination with the people around you. And that's really important to find out that your client, you have the clients that are in need, and you have the partners in your community that can support and sustain this program in terms of a compassionate community. So I think that's really what I would say is the most important in terms of your vision of implementing Nav-CARE, making sure you have the what it takes, the background, the strength of people, and the time and the organization to be successful program.
Cool. Thank you, Cynthia. And Cynthia is from Teresa Delar Palliative Care Residence. So when you first pop on, please tell us where you're from. Linda, did you, I saw that a little note came up that you connected to audio. So can we try that again? Oh no. Maybe Nick and you can work in the background. See if there's a way you can resolve that. So on my screen, Sandy, how about for you folks up in Northern BC?
Well, thankfully, I work with a very skilled mentor who is very adept at finding programming that does dovetail nicely with some of the infrastructure that we've already got here, as far as being a nonprofit, volunteer-based hospice organization. So branching out some of the things that we've been able to offer, Nav-CARE fits so seamlessly into our model already, because we're kind of, you know, traveling up and down Highway 16, trying to educate little nexuses of trained volunteers who can offer relief and support to struggling community members. And sometimes these communities don't have health units. You know, they may have, you know, a nurse, you know, a community health nurse, who then, you know, kind of becomes de facto everything for these folks. So if there's somebody in the community who can recognize need and then go and help in a more direct way, rather than having, you know, to deal with the sort of infrastructure and, you know, administration of things, that's preferable, because we kind of deal with a little bit, not just rural, but remote communities with very little in the way of medical care, sometimes none at all. So it's community members helping community members.
For sure. Thank you, Sandy. So Sandy, a quick, just wondering if you can give a little bit of context where Terrace is, like you said, rural and remote. Can you just describe that a little bit? Because it's very different than Cynthia's context, where she's in the heart of, well, not the heart of Montreal, you're in Kirkland. So, but it's very, very urban, and you are not.
No. So I am very grateful to be able to live and run programming on the ancestral and traditional lands of the Tsimshian, the Niska, Gitxsan, Wet'suwet'en, and Haisla people. We sort of go into community and offer training to folks who, yeah, as I say, may have a health center building, but maybe it's open twice a week, or there's a traveling health nurse who comes to town. Or, you know, in the case of Stewart, BC, it's a, you know, community in the far north with the largest deep water ice-free port in North America, and has, you know, a year-round population of 450 people. So those guys are 4 hours away from us, and we are this little nexus hub between Prince Rupert, Kitimat, Stewart, and Houston is kind of our purview there. And there's some great hospices along the highway, but the communities in between are often underserved or not served at all.
Mm, yeah, yeah, wow. So that looks very different than, say, from Hospice Peterborough. Carolyn, if you don't mind talking about your organization's a strategic plan and how this would Nav-CARE fits with you. It looks very different than what Sandy and Cynthia's kind of addressed.
Sure, thanks. Yeah, so Peterborough, Ontario is about an hour and a bit northeast of Toronto, and we're urban. We're in a city of about approximately 100,000, a little bit less. I think that within our rural population, we have somewhere around a total potential population of clients of around 125,000. So we're in an urban center, definitely smaller than somewhere like Montreal. But we do have to sort of navigate the rural piece as well with our clients in the community. So Hospice Peterborough has been an organization for over 30 years, started as a community hospice, so meaning that all of our services were provided in the community or community programs at whichever hospice location we were at. In 2019, we opened a 10-bed hospice residence in Peterborough. So I'm now, we're all now sort of under the roof of the residence, but I'm definitely part of navigating and maintaining the community programs in supporting the volunteers. So I think that Nav-CARE definitely aligns really, really strongly with our mission and vision, which is to, be a hub for hospice palliative care in our community and to provide supports to as many people as possible. And I think it also really helps to take us back to our roots a little bit, because every program has constraints. And I think that sometimes when you start to sort of define, we have a palliative care community team. And so defining which clients can be taken on at a given point in time, they all are going to have a palliative illness. But for the most part, when they're connecting with our team, which is made up of a nurse navigator, doctors, and supportive care, they are going to be connecting once their illness is further along. So even to say within the last 1 year to 6 months of life. Whereas with the Nav-CARE, and we've always tried to support people with a longer illness trajectory with our volunteers, but the Nav-CARE training has really helped to make those volunteers feel very empowered and skilled in what they're doing, in helping to support the quality of life of people in the community and hopefully help them to live comfortably and with a good sense of well-being in their homes for a longer period of time. So it really just takes us back to our roots to be able to do that, I think.
I love how you frame that, taking us back to our roots. And I'm thinking about like grassroots organizations such as what you all kind of are from, and their important position within the communities to be providing care for those in their communities. So I'm going to open up to Jan and Emily, and Jan and Emily are from Home Hospice North Lanark, and perhaps Jan, given that you're a board member and we're instrumental in bringing Nav-CARE to your organization, maybe you can speak to this question about how it aligns with your strategic directions.
Thanks, Gloria. I managed to get here in good time.
Nicely done.
I didn't hear any sirens coming behind me, so hopefully I don't get a ticket in the mail, but anyhow, that's okay. So from the strategic end of things, I'll just speak on that, and then Emily can talk from the client end of things. The board of Home Hospice North Lanark, our strategic plan was to expand our program to be able to support more people in our community. We are a rural community about 45 kilometers west of the city of Ottawa. I believe the total population is 11,000 odd. About 6,000 of that are in rural, on farms, in fairly isolated, locations. We have some communities like Clayton, where there is virtually no cell phone or, Wi-Fi service. There is no public transportation. Don't get me on that. That's a personal beef, because it's people need to get where they need to go, and there's no public well, in the town of Almont, there's not even a taxi service. So that'll tell you how rural it is, and underserved. So having got Nav-CARE on board and coming on board with Nav-CARE has opened the opportunities and possibilities for us to be able to support more people in their homes with various and different supports than we were previously doing. We've been able to engage with more volunteers. It has gotten us out into the community. And of course, we get no funding. I like to say this because it gets it out there. We receive no funding, and maybe you folks in Peterborough are on the same wavelength as us, but we get no funding from anyone at any time for anything, not 1 cent. So all of our organizational expenses come from the money for that comes from donations and fundraising. So it sometimes is it's a 24-hour-a-day job, not only supporting clients, but trying to figure out how we can fundraise 24/7 to support an organization to continue. Anyhow, we have survived so far for 11 odd years, so hopefully we will continue. But Nav-CARE has been wonderful. So for anyone who is wondering or thinking about coming on board, I would highly 110% suggest that you do. You will find it very fulfilling. The scope of who you can support client-wise is 100% more than we were doing prior to June of last year. Support from folks like Gloria and the Nav-CARE team have been wonderful. So I would highly recommend it for sure.
Thank you, Jan. Thank you so much for that. Emily, do you want to weigh in?
Thanks. I don't have too much more to add. Jan kind of covered it all. It's been fantastic. And just how it Nav-CARE has aligned with our plan is just reaching the community and providing compassion and helping our volunteers and expanding what they already know and just putting it into place when they're meeting their clients and helping them. So it's been fantastic.
Lovely. Thank you, Emily. BC. BC is from Hospice Halifax. How does it align with Hospice Halifax's strategic directions?
Hi, everyone. My name is BC. Hospice Halifax is a community of compassionate, supportive staff, donor, and volunteer. And we have a large base volunteer working with Hospice Halifax since it was opened. And one of our organization's strategic plan is to ensure that we improve our access to the community. So Nav-CARE has really helped us to achieve this. So the Hospice Halifax is a 10-bedded structure. So we realized that most of our volunteers really want to work with clients one-on-one. And we have well over 200 volunteers with us. So it was difficult for them to achieve their desire of working with clients and their families one-on-one. So with the Nav-CARE program, they've been able to take on this aspect of volunteering, and it's been quite encouraging because we've been able to get access to the community, be able to impact people that have declining health positively. And I'll just say, and we've been able to extend our resources into the community. So Nav-CARE has been a very good program for Hospice Halifax, and it's aligning well with all that we plan for.
Wow, thank you, BC. And Linda, hopefully we're able to, I see you're on the phone. So hopefully we'll be able to connect with you.
Okay, is this working?
Yes.
Yay! I'm like, where are we? Anyways, for our hospice, we're actually a community-based hospice. We're in a region also known as Kootenay Boundary, and we have a shared history with the Snakes, the Silks, and the Ktunaxa nations, and several Métis communities. So that's actually some of our focus, is trying to build more connections with all of those communities, because traditionally that has been quite a challenging thing for them to access services and healthcare in general. But one of the issues we have in our area is, because we are not a freestanding hospice, many people in our community don't think hospice services exist, even though our society has been operating for the past 30 years. So introducing Nav-CARE into it is another opportunity for us to engage with the community. And so we not only build resources and support and connections through the Nav-CARE program, which has been outstanding, and we reach people sooner in the process, if you will. Sometimes that journey is very rapid. So if we've already made a connection at the Nav-CARE level, we're able to support them through palliation and grief support. And because that relationship has been developing, or the trajectory is happening so fast, they may not have even had time to connect with the other hospice services that we have. So it's not only benefiting a broader range of people within our communities, it's also developing more for our entire hospice organization for everything that we do. Friendly visitor program, our palliative program, our grief support, and as adults and children in the community, we have programs that people are finding out about through speaking about Nav-CARE and all the services we have. So it's been nothing but a positive experience in our community.
Wow, thank you so much, Linda, and I'm glad the phone is working. So what I'm hearing from all of you is really that motivation to connect in more fulsome ways with the communities that you're located in. And that is, part of your strategic plan is to do that. And and from from my point of view, and having the privilege to working with you, seeing how effective you folks are in being able to connect with your communities and raising the so thereby kind of raising the profile of your organization, and which is kind of a win-win situation. So I'm going to now move on to our next questions, but before I go there, there's 3 questions in the Q&A. And Lisa asks if it's around the funding, whether the smaller organizations need to be community hospices, or can we partner with other nonprofit seniors organizations. And yes, you can. We do need to pass that through Health Canada, as we were originally funded for hospice organizations to support smaller hospice organizations, but that doesn't necessarily fit within the diversity of contexts that we have in our country. So yes, we are open to that conversation. Diana is asking how Nav-CARE aligns with Better at Home or Caregivers of BC. Diana, I'm not entirely sure about Caregivers of BC, but the Better at Home program, from my understanding, is a little bit more short-term and focusing on tasks. So Nav-CARE really aims to develop longer-term relationships with clients and help and journeys alongside them as they move towards the end of their life. And so, I'm from my understanding of Better at Home, that is not necessarily the goal of that program. It's a bit more short-term and a bit more focused on what that task is. You finish the task and then you might move on to another client. Now, maybe Linda and Sandy, if you have other insights on this, given that you are from the BC that you can weigh in, but Diana, I can also have a conversation after this webinar with you to unpack that a little bit more. Linda and Sandy, did you want to weigh in? You're good?
Well, we actually delivered the, oh, sorry, Linda. You go ahead.
No, you started.
Well, we actually work with family caregivers of British Columbia in our program as well. And that has been a major contributor to some of the good work that we've been able to do in the programming. It deals with people over 55. So either the care recipient or the caregiver need to qualify to be a senior for this program in our iteration of it anyway. So Nav-CARE basically opened up a piece where there were less criteria to like age restrictions and things like that. So it allows our hospice society to kind of pick your family up at diagnosis and move through acute care, and then on to palliative care, and then on to death and dying, and then on to grief support. So our family moves with your family through the arc of this journey with your loved one. So and I can't say enough good things about the contribution of the online learning piece. So to rural and remote communities where we have reliable internet, this has been a real boon to kind of augmenting some of the training that we've been offering and developing for rural hospices. So that's been very interesting. Sorry, Linda, go ahead.
It's interesting actually, because we have a very strong partnership with Better at Home program in this area. And we quite often work together and will cross-refer clients if there's specific needs that one organization can't address, then we will suggest the other organization as a partner to work with. So it's been successful on both ends. And, you know, we've been doing this for close to 2 years, about a year and a half, and we've done several presentations jointly, and we've, there's just situations where one program supports the client more than the other. So we just go with whichever one works best for the client, and, you know, it's all good.
I think that's a really important point there, Linda, and we'll talk a little bit about this a little bit later, but and I think, Cynthia, you and I have had this conversation before about how programs complement each other and are not in competition with each other. There is like an enormous amount of need in our community, and each of these programs have different strengths to be able to meet these needs. And so if we work together, we certainly can then just meet those needs of the client in a more positive way. So thank you. I see that there is other questions, but we'll save those questions for the next round, if that's okay. Other than Christie's, because it kind of fit with what Sandy was saying about criteria. The criteria and what are the criteria for clients to be able to join Nav-CARE, and it's quite open. It is on some hand, it does depend on the hospice organization themselves, but Nav-CARE itself, in the way it was sort of developed, is that it's open for those who are living with declining health. There's primarily adults. We haven't trained volunteers to work with children, which could be a different adaptation for us. But it is it's quite open, and we're a diverse group of people with diverse needs, and it does kind of depend on that hospice society. So I'm going to go back to my screen share, and we'll move on. So the second question, we're only on the second question. This is great. So, and the panelists have already talked a little bit about this, about the capacity to start and sustain a Nav-CARE program. So a couple of the things that you might want to think about when you think about sustaining, BC really talked about their volunteer pool and this amazing volunteer pool that they could draw upon and offer different kind of service that they could bring in for the volunteers. And so think about your volunteer program, volunteer pool. Do you have a sufficient number of volunteers to support the Nav-CARE program without depleting your current pool? So volunteers are so generous, but you don't want to burn them out either. So to think about that. And then, and do you have volunteers who want to work with clients over a long term? Organizational stability, something that we've learned over the past years of doing research, is that stable leadership is really, really important. So that leadership to champion the program during the implementation phase is really important. And rapid change can leave limited resources for new initiatives such as Nav-CARE. And then finally, in terms of other program, like what are the things you got going on in your organization, and is this the right time for you? Like if you've got 20 different programs that you're trying to initiate at the same time, it might not be a thing that you could do right at this moment. So because Nav-CARE does require dedicated resources, especially in the implementation phase, and we'll get to that in a minute. This is kind of linked to a bit of Christy's question. Who in your community needs Nav-CARE? Who can you target? So as part of your planning, it's important to identify this group of people that you're seeking to serve, and scan your community to see what other services exist to support that group. And this really entails developing partnerships with key stakeholders and educating them about what you have to offer, and negotiating capacity, kind of what Linda talked about with their relationship with the Better at Home program and how they work together to negotiate capacity. So I am going to stop sharing again, and we're going to turn this back over to our panelists and ask you a couple of related questions here. So who in your community are you serving, and how did you develop partnerships to reach these people? And maybe we can start with Emily first. Emily from Home Hospice North Lanark.
Thanks. So just going back to the implementing the program, which really helped gain new partners, or when we were implementing the program, we were reaching out to partners that we had before or really didn't connect with, and Nav-CARE gave us an opportunity where we could go back into the community, reach out to some of the doctor's offices. We have local paramedic service, the community care, the Lynn hospitals, like day programs, physio. It just gave us an opportunity where we could go in, talk about the Nav-CARE program and who we're servicing, which is anyone with, as we have, and present to the community with life-limiting illness, and people that are isolated, which affects so many people coming sort of out of this pandemic. So many people had been isolated from home. So it's just been such an opportunity to re-establish some of these partnerships that we've already had in the community. And from that, that's how we get a lot of our referrals are from these new partnerships that we have. So something that I learned from you folks, Emily, was these partnerships with the libraries. Do you want to share a little bit about that, if that doesn't put you too much on the spot? No, that's okay. I will. So we had called them our satellite offices. So these were established before I came on board with Home Hospice North Lanark. And it was an opportunity where we could be out in the community in a common area. We partnered with the libraries, and it was just where we could be available to the community. They can come into us. We have a list of books, specialized in like grief and bereavement and what to expect with a death. And if people want to come out from the community or some of our already clients, it just gives a common ground where someone can come out and just ask about what we have to offer. So
Lovely. Thank you so much. BC, how do you connect with the, develop these partnerships to connect the clients that you folks are serving?
Okay, yeah. So when I joined Hospice Halifax, I had to work with the social support unit. So where we have the social worker, the bereavement counselor, and all the staff that supports the patients and their families in hospice. So that was a great resource for us. So we were able to connect with all the organizations that the social worker had connected with in trying to gain support for the clients and their family, the patients and their family. So with that, we had presentation to various organizations, including the library, including residential support services, VON, continuing care. So we're able to work on the organizations that we've ever had contact with in Hospice Halifax, and there were a lot. In the past, I started in August, and in the past few months, I've presented to over 15 organizations. So it really make it very easy because there were established organizations that we had to contact for families and patients. And so the bereavement support group is really massive in Hospice Halifax. We have an established bereavement support group that talk to clients and their family once we lose any patients in Hospice Halifax. So that's one of the organization program that Nav-CARE is really working with and getting a lot of resources from.
Wow, 15 organizations that you presented to in the past little bit. That's remarkable. Thank you, BC.
Thank you.
How about for you, Carolyn? What kind of partnerships are you developing with your community as you kind of go back to your roots?
Well, I feel like the perspective is a little different, but something that Emily mentioned that I really think is important, it was important for us, was the timing of when we became involved with Nav-CARE, just on the tail end of everything that happened in our organization when we had to shut down or augment so many programs throughout COVID-19. So we, being in this cohort, just became involved with Nav-CARE in June 2022. And that is also when we were finally able to invite our volunteers to go out into the community and start providing supports again. So for us here at Hospice, I think our opportunities to partner in our community will grow. I think for the last 6 months, we've really focused on reestablishing connections within that volunteer pool in our organization who were connected, but connected throughout the pandemic. But I think Nav-CARE serviced us in a way that we could really kind of give them something new, give us something new, to use the Nav-CARE training even as a bit of a refresher, because so many of the elements of hospice volunteer training, they connect really well with the Nav-CARE training program. So volunteers who hadn't been able to go out and visit clients for upwards of 2 years were now able to do so again. But to bring everybody together and to use Nav-CARE as a bit of a guide to help us enter back into that space and kind of remind them about the important pieces around communication and boundaries that they had already learned. But then also add to that the empowering them to be advocates for their clients in the community by really being keen observers of what's happening with their quality of life and the possibilities that there might be to connect them with other organizations. So, so for us, I think we were, maybe somewhat uniquely situated that we have this pool of clients already within our organization that were ready and waiting to be serviced. And so it all has just flowed very, very nicely for us in the last 8 months.
Wonderful, and that's neat to hear. It's like reigniting the volunteers and their willingness to service. That's fantastic. Sandy, I see you nodding your head, so you're up next.
Well, yeah, I can't agree enough that the Nav-CARE Piece to Training was a nice, like for some of the folks who haven't been through volunteer training with us since before the pandemic. We're a relatively new program. We just geared up in June. And yeah, just to be able to offer that online piece, maybe some updated learning that, maybe hadn't, because we don't say you have to do refreshers every 5 years or whatever, even though that might not be a bad idea. But it is like a really nice kind of like
I think we might have
it was just
Sandy, you froze a little bit there, so you might have to back up a little bit.
Oh, okay.
Yeah.
It kind of dovetailed so nicely with our values and sort of reiterated some key pieces of our own training, that it was just like a nice like digestible model of modules that you can do from home that are very accessible and touch on some very key points that we thought were very valuable for a refresher.
Cool. Thank you. Linda and Cynthia, do you have anything to add there in terms of connecting to the clients and the partnerships that you developed to connect there? Linda, go ahead.
Thanks. The only thing I would add to all of those other great opportunities is actually going to service groups and community organizations, such as, like in our area, we have an Italian club, and we have different organizations that wouldn't normally be connected with healthcare, but they might have people who they know need NavCare services, or they themselves want to be a navigator, and this type of program appeals to them. And the other area that we get a lot of referrals and have really been able to establish the program is through palliative rounds with our health authority. So we sit on a table with all the other, palliative care physicians, physiotherapists, community pharmacy, community paramedics, OT, physiotherapy, all these other areas that social work type of thing. They all are connecting to their piece of it, and to be able to come together as one group has been very beneficial to everybody. And there's another community organization that focuses on under-resourced people in our area, and that's also been another area that we've been able to really connect with people we might normally not be able to make a connection with, people who don't have internet access, people who don't have, stable housing necessarily, or they just don't, or they don't like accessing the healthcare system, but they're willing to have a NavCare volunteer come and help them. So those are other areas that we found good connections.
That's a really important point there, Linda, about like what tables are you sitting around, and how do you leverage that participation around that table to support the program. Cynthia, do you have something that you'd like to add?
No, I think a lot was said. I think what I would add is exactly that when get involved in the tables, the round tables of your community, I think is really important, because I think as much as I think the initial partnerships you want to connect with is healthcare in various ways. I know each province is different. In Quebec, we have the CLSC, which is like the Ontario Board of Health in a sense, and having that connection with them and with the hospitals and the doctors' offices and the physios and all of those people that are health related is really important. But I think also when you're on your round tables of the community, getting to know your partners is really very important. So it's as you had mentioned, to how you can help each other. But I think it's important when you're starting to make the effort to get to know what their needs are and to make an effort to support them in that. And I'll give you an example, like, you know, we had one of our community organizations have a 15-year anniversary. So for us, it doesn't really reflect on us, but in that sense that all the communities come together and support them in their anniversary, saying, great for you, good for you, let's celebrate together. And just being there for them makes a huge difference when you're you know, making those connections. To me, it's all about the community connections, because the healthcare is there, and keeping in mind that healthcare for us anyway, with the CLSC in Quebec, they are so overloaded, and I know every other province is overloaded, that when we can come in and say, hey, we can alleviate some of this for you with Nav-CARE. If you will work with us, we can actually alleviate some of this stress for you. That makes a huge difference. So again, it's a give and take, but it's getting to know them personally. And I think really knowing what your other organizations do and what their needs are too. So that's what I would add.
Such an important point, Cynthia. Thank you so much for raising that. And it reminds me of, you know, we talk about how the relationship is like the key thing about Nav-CARE is between the relationship between the volunteer and client, and that relationship over the long term is as equally important as the relationship between organizations, and developing and nurturing those relationships. And what you just spoke to, Cynthia, really attests to that. So thank you for raising that such an important point. So I'm not going to jump back into my PowerPoint, because the next point is all about the next question to consider. The fourth question is all about the importance of the volunteer coordinator. And we have learned over the years of research that the volunteer coordinator is, or the person who's leading the volunteer, whether that you're calling yourselves a coordinator or not, you are the most important factor to the success of Nav-CARE. And, you know, Bissy talked about the organizations that she's presented to. And so there's the coordinators having some strong presentation and mentorship skills there. They're connected to their communities, as Cynthia is pointing out, the different, and Linda pointing out the different tables that they're sitting around, and Emily talking about the people that she's been interacting with. And so I am wondering, I think it would be really beneficial if we could just take a moment, first of all, take a moment to acknowledge the incredible work that you folks are doing, and the volunteer coordinators across Canada from the sites who might not be participating with us right now, but everybody who's in the kind of role that you're in, like, your work is vital. And so I'm wondering if you can just tell us a little bit about your role, like, what do you do? And perhaps we'll start with BC here first.
Okay, yeah. So as a volunteer coordinator, one of my roles is to recruit volunteers for the Nav-CARE program. That is very easy for me and quite seamless, because Hospice Halifax has established training and screening program for their volunteer. So I was able to work on the pool of volunteers already waiting, trained, even though they still had to do Nav-CARE training, but it was easy for me. And another good thing is we had dedicated, committed, compassionate volunteers. So the training was easy and people were willing. So I was able to train volunteers, and both after the online training, they had to come in for in-person workshop. So that's part of my role. And so apart from training volunteer, another thing that I do is I talk to clients. I talk to prospective clients one-on-one. I do presentations to organizations. And once I get a client that I feel will need the program, I would have to pair a volunteer to the clients to ensure, and also ensure that they are good fits, that I'm pairing a volunteer that is a good fit for the clients. So I think essentially those are my role. And then I'm the face of Nav-CARE for Hospice Halifax, which is very important. I speak to everyone I see about the Nav-CARE program and how it's aligning with the Hospice Halifax organization strategic plans.
Wow, thank you so much, BC. A lot, there's so much, like there's so much in there that we could unpack of all the different things that you've kind of identified and listed off, because that's an enormous, an enormous part of the role, is that that volunteer client sort of matching and making sure that there is a good fit between. And so I'm wondering if maybe Linda, if you don't mind kind of touching upon that and then describing some more of what you do.
Just trying to think. BC was so well spoken on that. Like everything she does. So yeah, that's good. I think in the smaller areas, the client volunteer matching actually is probably a little easier because we do have such a relationship with our volunteers, not only from a Nav-CARE perspective, but just in the community, like we just know them. And so we also, through our volunteers, are able to connect with other community organizations because often our volunteers are also volunteering in other areas. So that's been very helpful for us. And I think if there's anything really different on that, I think I will just step back and let somebody else talk because I don't think I'm adding to anything here.
Sure, no worries. Thank you so much, Linda. I'm going to turn it then to Emily and Sandy, and also speaking like from the rural perspectives, like what kinds of things do you do in your volunteer roles? I'm thinking that they're going to look a little bit different. So maybe perhaps we'll start with Emily. Emily, if you don't mind sharing your experiences.
Sure. So similar again, I mean, meeting and welcoming all inquiries, and really, you know, some of our volunteer pool and inquiries that were wondering about the program. I also went out to them and to go see them and speak to them about what becoming a volunteer is, and just providing them guidance. We have a lot of new volunteers that have never been in hospice before. So it was just really ensuring that they understood what they were applying for. What else can I tell you? I had it all when you guys were talking and then I've lost it. I'm sorry. And then I guess I think Linda and VC had covered a lot of it. I had something on the top of my mind and it's shot out the other way. So I don't know if Sandy wants to add.
No worries, Emily. We can, when it comes back to you, you can jump back in.
Sure.
It probably just shows, Emily, how overwhelmed we are sometimes. We've with our work.
I mean, I'm sure that saying ditto is kind of like not great for a panel member, but we do, even though we're from a rural and remote perspective, share a lot of the same experiences with things. The only thing that I would add from my perspective is I spend a lot of time in my car, just being a constant billboard for the Nav-CARE addition to our family of services, because it is such a great program and so accessible. We believe very deeply at our organization in collaborative work. So, you know, we are knocking on doors. I'm the queen of the cold call. I'll just show up when you least expect me and, like, you know, bring the Nav-CARE message along with the other. I kind of do the other program kind of outreach as well. So for Terrace Hospice, so for our grief programs, and so for our friend and family caregivers of the Northwest programming. So yeah, like I'll just drive to your village and walk up to your band office and bring them 24 Timbits and tell you everything about Nav-CARE, and in a very informal and approachable, like, things up here are very relational. They're very relationship based. So feet under the table is great. I personally use a lot of the pharmacies because they are so perfectly placed to have the time to sit down and talk about medication delivery, like see the family eye to eye, who's struggling, who's not, and then they can also pass on my literature and all of the things that I provide to these places, so that when someone does show up and is struggling, that phone number is right there, that you can self-refer, which is so great. We don't have to wait for any organization to see you. You can say, hey, I need help, which is kind of me always banging on about suffering in silence, and why do that when there's so many loving people in your community who want to support you. So anyway.
Sure. Thank you so much, Sandy. And BC, I saw that you raised your hand there. You wanted to add something?
Yeah, I just wanted to add that part of my role is to support the volunteers. So sometimes they come with issues of not sure of how to start a relationship with the clients. They have some emotional challenges. They've done something relating to this in the past and it wasn't going well. So sometimes they just need somebody to talk to about how to do that with clients. And so emotional support is really part of my role for the clients and for the volunteers. And apart from that, I meet regularly as much as possible with the volunteers. And while meeting, I try to figure out what they need to improve on, what they need to know. So we do like a form of continuous education for our volunteers, something that would help them with their role as a navigator. Yeah.
Wow. Yeah. Yes, go ahead, Cynthia. Thank you, BC.
All right. Well, sorry. I just wanted to add to, I think exactly what BC said. A big part of the volunteer coordinator role is to support the volunteers, and that goes on and on. It's not just when you're initiating Nav-CARE, it's constant, really important, because your volunteers are everything. They are everything. And they will always need support, even as they get more familiar with new volunteers get more familiar with the Nav-CARE program, and they do meet clients, even those that work in hospice and have that hospice background. There's always a need for support. And for us here, and I can't take credit because I came into this role when it was kind of starting or almost developed, but we have monthly support groups every month for our volunteers that they can come, and we try and do it in person. Of course, we're back to in person now, where they get that emotional, as you said, BC, the emotional support, any concerns. What's great about that is the volunteers help each other and support each other. I think that's really good too. But I think you always have to be available for your volunteers. I try and do bi-weekly Zooms with them, although, going forward as a volunteer coordinator, I don't think that's possible. As you bring in more clients and more volunteers, it's just too many people. But I just wanted to add that. And I wanted to add also that it's really important to keep track of your volunteers and your clients and have a good system to keep track of it, because having like bi-weekly reports or bi-weekly messages or emails or something where you can always know what's happening with the client. And also assessing, because a lot of the volunteer coordinators go to the homes, as Sandy said. Here we do too, even in a bigger urban area. I go to every single first assessment for a client. And then when the volunteer is matched, I go again for the first time to match the volunteer. So you have to think of that. It's really important. And then matching, talking about matching, matching is really important, connecting the right people, but it's a constant balance, because you might have some more volunteers than clients and vice versa. So you're always trying to make that balance. So I just wanted to bring those things up because that's part of the volunteer coordinator role. Thanks.
Perfect. And I see Emily and Linda have raised their hands. So Emily.
There we go. I was just to add to it. Yes, we also do, we do monthly meetings where there's opportunities, whether we're educating our volunteers or it's just to have discussions. And I know our last one, we had much success, and it was just to recap what Nav-CARE is and just having discussions with them. Something that I also do is I also do I do follow up with our clients, but I really want to identify with our clients what they find beneficial from our volunteers, and then I share that with the volunteer in order just to reassure them that they're needed and they're supporting someone, and that they're really making a difference in someone's life. And I think that's important to share with them. I think they know that, but just whatever that was to make that person's day great in that moment. And it's uplifting. Yeah.
For sure. For sure. Thank you for sharing that and reminding us that to give that feedback to the volunteers, right? That's an important part for their well-being. Linda, you had your hand up as well.
I think most of the stuff that I wanted to talk about has been explained here as well. We do the monthly meetings, and we try and be very responsive in like at our local healthcare facilities. It can be a truly daily situation on, do our volunteers, can they even get into the hospital? Do they need to wear protective gear while they're there? So, that sort of thing. And so we just end up like, okay, so does everybody actually know how to don all of the gear that they need if they have to actually do isolation when they go into a healthcare facility, those type of things. And then in our area, I would say 85% of our volunteers volunteer across the spectrum of our services. So even though they may only have one Nav-CARE client, maybe they are seeing 2 or 3 grief support people, and maybe they're volunteering to do an overnight vigil with another person. So one of the things I really have to pay attention to is burnout for our volunteers. And we do a lot of discussion amongst our coordinators about that, so that we're trying not to. We always let them know they have the option to decline a new client, and no questions asked. They don't have to justify themselves. If they're not feeling that that's the time for them, then we just leave it at that, and we'll come back to it later. And there was another point I was going to make, but I am similar to Emily, and I can't remember at the moment. So we'll just leave it there.
All right, perfect. So I'm keeping an eye out on the time, and I'd like to address some of the questions that are in the chat. I'm going to start with from the bottom up. So Peter has asked, what is the policy of Nav-CARE regarding vaccination of volunteer and disclosures to clients? So Peter, that is according to the policies of the hospice organizations themselves and how they practice, and the jurisdictions and policies of the different provinces. So Nav-CARE itself doesn't have that policy per se, but it is the program of a hospice organization, and so that's for that one. Patricia, she writes, we currently have a hospice visiting volunteer program, and it would be nice to incorporate Nav-CARE. I'm wondering how a Nav-CARE trained volunteer would align with hospice community social work that assists clients navigating the system, advocating and providing emotional support. So something that is really important in the Nav-CARE education is about boundaries. And so Nav-CARE volunteers are not healthcare navigators, and they do not take the role of a healthcare professional. And I know we've had conversations about boundaries a lot, because Nav-CARE volunteers and volunteers in general are asked to do quite a bit of stuff, and especially in this day and age with such a healthcare system that's so strapped, volunteers are asking to do things that perhaps are around the scope of practice of a healthcare provider themselves. So we're very aware of these boundaries, and I know that all these amazing volunteer coordinators really do talk about this a lot in the training. So then the next question from Lorraine. Lorraine, our last piece that we want to talk about is about sustainability. So we're gonna we'll just shelve that question for now. So it's about sustainability beyond the 2-year funding, and so we'll be addressing that in a minute. Megan asks, as a small town home care nurse, getting involved with Nav-CARE, would that be considered a conflict of interest? And so the other day I was looking at some of our stats, and a lot of our volunteers actually are either retired healthcare providers or currently practicing, and they do also volunteer as in hospice palliative care as a Nav-CARE volunteer or another type of volunteer. And so just a quick question to our panelists: do they see currently practicing healthcare providers as volunteers in their organizations? Everybody's nodding. Go ahead, Carolyn.
I think our policy, though, is to say that someone might have a background that they might still be practicing as a social worker or a nurse or another healthcare professional, but they wouldn't hold those 2 roles at the same time for the same client. So we would never assign a volunteer to someone, Nav-CARE or otherwise, if we knew that that person was already involved with that client in a professional capacity. So I think that's
that makes
kind of where we draw the line.
Yeah, that makes a lot of sense, and again speaks to the idea of boundaries, right? Yeah. There's a few questions here, so so I'm just going to plow through them. So, do we have specific training for Nav-CARE? Yes, we do, and it is online, and it does. So you ask. We have a hospice volunteer training within our organization already. Just wondering if we have to ask volunteers to double up on training. And so Nav-CARE was designed to complement and build upon hospice palliative care competencies, and whether it's through CHPCA or Hospice Ontario, so the different competencies that are coming out of these professional bodies, and so builds upon that. And so yes, it is additional training, but it is you can do it online, and there are some things that do overlap, as I think Carolyn, you talked a little bit about how you would focus your attention more on one part versus another because of the competencies through Hospice Ontario. Then Lisa asks about, question might be too detailed. I'm wondering if you can also share a little more about what's in scope for the volunteer role regarding practical supports that are offered in the home, for example, cleaning, transport, accompanying to medical appointments. So I'm going to turn this over to the panel, because that is very much a very specific question for how organizations the boundaries that the organizations put around the roles as well. So I know that some organizations allow for some things and others don't in their own types of practices. So maybe just if one person could respond to this question, I'm going to maybe ask Linda, if you don't mind responding to this question.
So if I'm understanding this, it's how do we make resources available to our volunteers? Like, how do they find out about the resources? Is that the question?
So it's more about what the scope is for the volunteer role regarding the practical supports. So, for example, are they able to do cleaning, or can they accompany somebody to a medical appointment? And I think it's going to look different from rural to urban, and as well. So, go ahead.
Yeah, some of those pieces are quite situational, and like we might not have a blanket statement that yes, we will always accompany people to healthcare appointments. That might be an overwhelming thing, but in a particular situation, that might be appropriate. You know, just kind of those tend to be more specific things. We want to focus though in our organization around making or allowing people to be as independent as possible for as long as possible. So instead of coming in and cleaning for someone, we would be suggesting, well, these are the cleaning services available in our community. And, you know, some of them, like these might be the costs, and then you can decide for yourself which one you would prefer to go with. So it's as your health declines, you tend to get a lot less agency over the decisions that you're allowed to make for yourself. So anytime you can hand that back to someone and say, you know, really, you can look at this. If you want to talk about what questions are important to talk to your doctor about or your nurse practitioner, we can help you with that. We can, like, what do you want to know? How do you frame that question? Do you want somebody to come with you to sit in the background and just write down the information if they feel it's too overwhelming? So we basically try and do the least amount we can while still supporting them so that they can have as much control over their destiny as they can.
Mm. That's a really great point about, you know, the sort of the losing of agency as you experience declining health, and then that gaining of agency of when you work in relationship with somebody who's there and being an advocate for you. Yeah, thank you so much. Oh gosh, we've got like 4 minutes left. So and Mandy and Ali have questions around hub and spoke, the hub and spoke model. Mandy, the funding is for that hub and spoke model. I really encourage both of you to have a look at the website. It is in the knowledge, the implementation tab on the website. So have a look there. So the funding is for that hub and spoke model. We also welcome any site to implement outside that funding package. So we're only got that amount of funds from that Health Canada contribution to implement in 15 hub spoke organizations, and but we are so open to having conversations to implement outside of that. There's no money attached to that, but I know a big thing in terms of sustainability and implementation is about funding, and one of you spoke about that already. Jan, I think she's off the call now. So so I'm not going to bring up the PowerPoint again. The question is around sustainability, and if we could have some final comments about sustainability, because that is a big one. We in terms of sustainability, we think about it in sort of 3 different ways, or 3 intersecting ways. One is it about the vision. So we spoke about how it fits in your strategic plan, which is around your vision and your vision for the future programs of your organization. Sustainability is also about the kinds of resources that you have now or the kinds of resources that you need over time. And then the final piece is about how it meets strategic policy directions for your organization within your community. So for example, Cynthia, you talked a lot about the compassionate community movement and how that really, your program is aligning with that. So I'm going to bring up, oh boy, where did the question go? I think it was somebody's question. So how do you envision sustaining Nav-CARE over time beyond this 2-year funding package? And so perhaps we can start with you, Cynthia, if you don't mind. Just a few words. We only have like 2 minutes left here, so. And
okay, understandable. I will be quick. I've already mentioned the sustainability is all about making connections. You cannot sustain anything unless you really, excuse me, make those connections with your community, support your volunteers so that ongoing they're happy in their role. It's a constant checking, organizing, maintaining type of role. But I will add one quick thing, Gloria, that actually, and I want to bring BC into this because BC sent me something I found was very interesting in terms of connecting with businesses. And when I look at sustainability for Nav-CARE, if we're looking for the future, when I'm retired, when we're all gone or retired or wherever we are, somebody else needs to be doing these things in our community, and we know they're so necessary. So having those connections with the healthcare, but also with people who are now working, who don't know about Nav-CARE, who don't know about palliative care even. They don't even know about palliative care till they need it. So I think we've started, we're doing this will be our second presentation to a company in our area to offer our services, Nav-CARE and various other ones, to support employees and their families and their loved ones, and teach managers how to offer those services. So that's all about sustainability. And BC also had I thought a great idea about connecting with fellow businesses to make sure they're aware of who you are. So that would be one thing I wanted to get across in a short time.
Thank you so much, Cynthia. Any other thoughts about sustainability? Carolyn.
Yeah, I think that really just in our case, trying to really align all the processes involved with Nav-CARE with the processes already existing in our organization has really, I think it's going to help us to maximize the sustainability going forward. You know, if you're already making the decision from the outset that it's a strong alignment with your organization's strategic plans, and then just building your program into your organization to make it work along lines that you can see being maintained. I think the statistics that we keep too, and that we need to submit for our funding are important as well, and keeping strong statistics is going to hopefully help our case to approach future funders or current funders in the future about the importance of keeping a Nav-CARE program strong in our community.
That's a great point.
The only
Thank you
thing
so
I
much,
would
Carolyn.
add to that, sorry, is through all those relationships and partnerships we've been building, there's also opportunity for granting applications with common interests between groups is another way you can help sustain your program. But we're looking more into that all the time.
For sure. Thank you.
Yeah.
Thank you, Linda. Go ahead, BC.
Yeah, another way I think will be helpful is to ensure that the Nav-CARE program is totally integrated into the hospice that you're working with. For example, one thing we've decided to do in Hospice Halifax recently is when to talk to our nurse that does the admission of palliative patients or people that needs to be coming to the hospice. So whenever we see any clients that is not appropriate for the hospice, we refer them to Nav-CARE. So the nurse is working with the hospice and working with Nav-CARE. So when, especially on the wait list, whenever any clients call in from the wait list and we see that it's not yet their time to come in, we refer them to the Nav-CARE program. So I think this is very essential as well.
That's really important, thinking about like that integration within your program. So we have well and truly gone like a few minutes over time. You know, it was interesting. Last year we only had an hour, and we're like, oh boy, I guess we should probably have a little bit more time because we were running out of time, and now we've definitely extended it to an hour and a half, and we still went over time. So it was just such a real robust conversation. There's a couple of questions that I don't know, for some reason I was not able to type in the Q&A box. I don't have a little response box. So there's two questions that I want to respond to. Amy has asked if you can facilitate a larger group of volunteers at once for training versus having to do it online. Yes, absolutely. And Carolyn has experience with that. They bring people together and work through the Nav-CARE training that way. And she's given a thumbs up for it. Then somebody else has asked about, they have a successful program in our hospice called PALS, Volunteer with PALS, venture through end of life with their seniors into palliative care. I think that PC means very similar goals and volunteer coordinator to Nav-CARE. Despite my desire to implement this, it's going to be a tough sell. And if they're doing something similar, and what range of funding would be offered to rural hospice, as not a hub. Unfortunately, us as a Nav-CARE program, we only have the funding available through that Health Canada contribution. So to implement Nav-CARE. So I'm not of other funding that's offered to rural hospice, though I know in different rural environments there are little pockets of funding through their Chamber of Commerce or other funders that could fund this. So there's that. But I think that the point about Nav-CARE could be a tough sell when there's like programs already available. So that is something to grapple with, and for us to respond to perhaps offline to this person who's posed that question. So I would like to take a moment to really thank the panelists for participating in all that great work that you are doing. I echo a comment in the box from Stephanie, who says, thank you for the great work that you're doing and bringing awareness to our community members about resources available to and for each of us. It really fosters collaboration. And so hats off to all of you for the great work that you're doing. And it's such a privilege to be in this space with you. And then thank you to our audience. I know we're losing people because we're going over time, but thank you for participating with us. Please feel free to reach out to me. If Nick, if you don't mind popping my email address into the chat box, you can connect with me anytime if you have further questions. I don't think I've answered some of them as fully as I could have. So please, if you need to follow up with me, please do that. I look forward to those emails. So thank you everyone for participating. I'm deeply grateful to you all. Have yourselves a really great rest of the day. Bye for now.